Hi, everybody. This is the Dr.Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Today's podcast is the infectious theory of aging. Now, that should perk your interest because what does that even mean? Well, before I get to that, a little review is in need because some of you are new. And what the podcasts are is Dr. Debunk, that's me, doing educational and debunking myths, garbage, and crap spread by doctors and health professionals. But what I'm trying to get done here is giving people an introduction to the concept of wellness, which we're renaming into optimal health, training and education. I'll get to that in a minute, which centers now around 10 theories of why we age at different rates and why we march towards disease, because there's a big variability. And so how it kind of works, or has worked over the last 40, 50 years is probably in the early 60s, non-doctors, nutritionists, naturopaths, homeopaths, all the other people related to health or health sciences began to look at the non-medical way for human health. I mean, somewhere in the 60s, doctors got accredited to or assigned to being the health experts, which is really dumb because we don't really study anything to do with health and wellness. We study early detection of disease, diagnosing of disease, and the treatment of disease. And I know many of you have heard that many times, but I can't say it enough. Nowhere in there do you hear anything about prevention or wellness because we just don't study it. We don't study it in school. We don't study it after school, continuing med. And so medicine does early detection of disease, and what we deem as wellness is really trying to find disease early, which is important, but has nothing to do with wellness. And so the movement got started outside of medicine, and there are some little things we do, to be fair, about wellness or prevention, but they're minimal, they're insignificant. And so fast forward 50 years later here, the alternative professions have put together a lot, pieces. It's been piecework. And in the last 20 years, there's been a more concerted effort to try to organize it, structure it. So it depends who you hang out with is what your views are. And so naturopaths a while ago teamed up with doctors in part, and there's a national academy called the American Academy of Restorative Medicine, which is kind of a dopey title because we're not trying to restore medicine or restore. We're trying to prevent the body from being broken. But I think it was maybe a way to bring in doctors, and so I'm a part of that, and every once in a while I get to go to one of the conventions. So it's really a joint venture between doctors and naturopaths, mostly naturopaths. But more and more it's growing, some chiropractors. And, well, the last time I went, which has been about 4 years now, they really were trying to change the terminology into optimal health. And I really like that and have been moving that direction myself. And so it can be broken down different ways. I mean, what are the things you have to do to be well? What are your things you have to do with your life to be healthy? Is it possible to prevent disease? Is it possible to slow down aging? And the answer is yes, unquestionably yes. There's even one of the older wellness groups is called the American Academy of Anti-Aging Medicine, which is really hokey title. They're not hokey people. They're trying to understand it like we all are. But the title's hokey because you can't anti-age. You can't stop the aging process. I mean, they don't really say they're stopping it, but some of the hardcore people believe that if the human body worked perfectly, we could live forever, which is nonsense. But anyway, the goal has been to understand the concepts that make people optimally healthy. And so I break it down into 10 different things. You can break it down differently. And so these 10 things are based on scientific theories, and therefore there's a compensatory or a action that you need to do and actions that you need to not do to not violate these theories of why the body ages at different rates and why people move towards disease at different rates. Because that's really the bottom line here. In my profession for 33 years, I see people that are 50 and look like they're 70, and I see people that are 70 and look like they're 50. I like that movie a lot better. And so optimal health is a matter of a number of things we do and don't do. And so these 10 theories explain them. As I said, you can chop it down differently. And so I have done some podcasts that you'll be seeing over the next few weeks that are based on a book I wrote about 4 years ago called The Oxidation Inflammation Connection, the most important medical discovery of our lifetime. And I think it is, because chronic inflammation is what destroys the human body. It's the beginning of the end. It's the basis. It's 50 to 75% of the causes of all disease. So the oxidation inflammation theory I address in there. Okay, so the infectious theory of aging, today's topic, basically goes like this. The rate at which you're being infected is the rate at which you're going to age and die. The rate at which you're infected is the rate at which you are going to accelerate the process of all diseases. Because we are slowly being infected with age. The germs that are outside the body are slowly getting inside the body. And the speed at which they get inside is going to be, in part, related to the speed at which you'll age and die and march towards disease. It's a newer theory, but it's very clear. I mean, any doctor who practices for many decades, as I have, you just watch people succumb to infectious processes slowly but surely. You just see it killing them. People that are struggling with congestive heart failure with age, or emphysema, what we call COPD, mostly from smokers, you watch their infection rates go up. You watch them start to get repetitive sinus infections, and then bronchitis, and then pneumonia, repetitive pneumonias. And then there's also infectious problems that occur from the intestinal tract. And so, depending on the other factors, depending on the other 9 factors of optimal health, how much you violate them, you'll succumb to one of these. And so in this model, we're talking just about the infectious theory of aging. And so, as I said, the germs that are outside our body are getting inside. So we're covered with germs. To give you a little science, a little background here. This is kind of gross, but if you could see the germs on your skin, we'd look like a walking beehive. We're covered in germs. There's literally on our skin surface billions upon billions of germs over our entire body. But that's not the worst part. The worst part is our intestinal tract. There are trillions of germs in our intestinal tract. Now, a little anatomy here. Our intestinal tract, from your mouth all the way to your rear end, to your anus, is a hole that's outside the human body. Sounds kind of weird, but it's outside the human body from your mouth to your rear end. It's not inside the body. That's just a tube that has the function of taking in water, food, and nutrients. And it's complex from the mouth through the intestine, small intestine, large intestine. But our intestinal tract is covered in germs. And you hear about the good germs and the probiotics. And this is an area where nutritionists, duh. That's funny. Nutritionists have worked for many decades, and you can hear people that are obsessed with bowel health and intestinal health and clean eating and all that stuff. And they're right on the money. But the dietary issues are different. Diet nutrition is one whole concept of human health, of the 10 factors. So that's different. But the type of germs you have and the healthiness, that's really covered there. I won't get into that. But it's just understanding that our intestinal tract has trillions of germs, and they are trying to get through the intestinal wall, into your bloodstream, into the cells of your intestines, and then into the bloodstream. And with age, this process is accelerating. And the rate at which these germs get in is going to be the rate at which you're going to age and the rate at which you get disease. And so many factors affect that. And so the big picture, which we'll talk some about some of the details, the big picture is stop it. Minimize the amount of germs that are getting from your intestinal tract, which is outside the body, to the inside. But this is also occurring with our skin. When people get skin infections, when they have chronic rashes, inflammatory disorders, that allows germs to get in. The other big place that people don't think of is your lungs, the pulmonary system. Our lungs are very permeable. Our lungs are like a sponge because they are sponges. They're sponging in air to get oxygen and removing CO2. But very small molecules and most drugs go right through the lungs. There was a big move in medicine a while ago to make drugs pulmonary-based, where you would use inhalers for most drugs. It kind of went away. I don't know whatever happened with it. I think it became impractical and not cost-effective. But it's a great way to deliver drugs and get very good drug levels, very reproducible, unlike oral medications, which is nutty because people absorb them so differently, which in part is related to the infectious status of your intestinal tract. But anyway, the lungs is a whole other area. So here's 3 areas that you have to work on, to stay optimally healthy. Is the air you're breathing clean, the stuff you're breathing? What do you come in contact with your skin? But by far the largest is what you put in your mouth, the foods you eat, and your intestinal tract health. So right now would probably be a good time to take a little break and hear a word from our sponsor. Hi everyone, it's the cold and flu season again, and this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Welcome back, everybody. This podcast, hopefully you're not jumping in here, but is a podcast on the infectious theory of aging, and I had left off with the 3 main sites of how the germs on the outside of our body are getting into the inside, from your intestinal tract, your skin, your lungs. And so I'm going to get into a little bit of the things you have to do with your life and not do. But what I didn't finish was how this works. See, it's not just the fact that the germs get in there, it's what they do when they get in there. The first myth we have to dispel here is a doctor myth. This is a Dr. Debunk alert. And the debunk is that doctors have led everyone to believe that our bloodstream is sterile. And so germs getting in there can't be tolerated, and we never really have them in there. Debunk. It's fiction. Our bloodstream is never sterile. It's just that the amount of germs that are getting in there are so small, we have no way to detect or measure it. But to believe that with the massive capillary beds that we have in our body, 100 billion, we essentially have 100 billion intersections that are areas where germs can get in. Not million, 100 billion. And so to say that these intersections are like watertight against germs is just ludicrous. There are always tens of thousands, probably hundreds of thousands or more germs in your bloodstream. But we have trillions, not billions, trillions of immune modulators, Or police. We have trillions of police that are looking for the bad germs, that are looking for them as they get in. And so the war begins from the moment we're born. And so this is one of the processes or problems with aging, is our ability to get rid of these germs declines with aging. And so what happens is we get enough germs in our body and they get lodged into tissues. You have microscopic tissue areas that are sites of infections. Imagine pimples. You see these kids with pimples, or, well, anybody, because the pores in your skin never go away. Anyway, but imagine microscopic sites all over your body where small nests of germs from the bloodstream are seeding into the tissues. And so they thrive there because they're getting the same oxygen and nutrients that your cells are getting. And so they're forming nests. And your body just can't get to them. Now, there is a ton of anecdotal or circumstantial evidence to support this theory. I think it's absolutely correct. It could explain very much so a huge part of autoimmune disorders. You hear about autoimmune diseases. People hear about lupus and scleroderma, and there's a number of like joint conditions. And you hear about this antibody thing where you're making antibodies against your own tissues. I don't really believe. I suppose it can happen, but you have to ask what change. I mean, if you truly were making antibodies against your own tissues from birth, you would have major problems, even in childhood. And these phenomenons can start very young, autoimmune disorders, but they tend to start more frequently with age. So the question is, what happened to your body? Why do you start making antibodies against your thyroid? A very common one. Why do you make antibodies against your joints? I mean, what did they do wrong today? What literally it means is the cellular structure, the cell wall had to change. And so it's like, why would it do that? But what if there were nests of germs embedded into the tissues? What if there were terrorists embedded into your tissues? Well, then, when you go into school one day and a bomb blew up, you could say, well, it's the terrorists. But medicine today is like saying, well, everyday people are just dropping off IUDs and blowing up people. No, crazy people do that, and terrorists do that. And so these germs are causing inflammatory reactions which could damage and alter your proteins very easily. I mean, we know this goes on. And so then you would be making antibodies against the bacterial or viral or fungal byproducts. And so then you have an autoimmune reaction, but we can't measure this. We can't see this in medicine, but it explains what's going on. I think it's true. I think this is at least a significant part of it, if not the main issue. But until we have the technology to measure this more precisely, it's just going to be a theory. But it does explain what we see. Anyway, so our blood's not sterile. The bugs are getting where they don't belong. They're causing problems. And so imagine your organs, in part, are being eaten alive by the bacteria, fungus, and virus that get where they don't belong. I mean, there's these connections that are building daily between cancer and viruses. And so how do they actually do that? I mean, how do the viruses get in there? Because our bloodstream is never sterile. And so based on all the other factors that are making you accelerate your aging and what's accelerating you breaking down towards disease, that allows the germs in this theory of aging to go wild. So anyway, that's why this is important. That is why it's so critical to embrace the infectious theory of aging and do the things you can to minimize that rate. And so back to the 3 sites. Well, what do you do to have great intestinal health? Well, the number one thing would be about your diet, nutrition, the foods you eat. And I won't get into that because that's a theory in of itself. But the main thing with food is what's common sense. Polluted food. As you get older, you got to stop eating polluted food. And I don't mean junk food, ho-hos and Pepsis and weirdo stuff. food that people eat when they're young and can't get away with. But polluted food, food that isn't natural. It doesn't grow in the ground, like things that are in cans and packages. I don't see any cans growing in the ground. But it's the chemicals and byproducts and hormones and pesticides and all the other weird stuff that's in the food chain. So the number one thing is to learn how to not eat polluted foods. Now, that's something I'll go into in depth on the Dr.Debunk website in the future. But for today, you can look into it and figure out real quickly how to eat a lot cleaner. The second thing is water, water, water. You will reduce the amount of infectious processes that are going on from your gut getting into your bloodstream by just water. We don't drink enough water as Americans. People should drink half a gallon of water a day or more, which gets into, enough said on that. And then clean water. Clean water is well water. The bottom line, we need to drink deep well water, natural spring water. That's what's natural. I don't care what you believe in. I won't get into that. But ultra-purified water is junk. Because nature, whatever you believe nature is, nature has given deep well, the earth purifies water in the process. Water that comes out of deep wells or artesian springs doesn't have any germs in it. It has a certain type of mineral mix, which we need, and that's it. So clean water, unpolluted water is deep well water, wherever you want to get it from, doesn't matter. But all these ultra-purified waters, I think they're junk. I think it's a gimmick. These companies, I won't name them so I won't get in trouble, but you know who they are. How do you know they really filter the water? How do you know they change their filters? They tell you right on the bottle, we put minerals in there to improve taste. So they could give you nasty, vile gutter water and then mineral it up with certain combinations because they figured it out. And then it tastes good. Oh, wow, great water. Those dopey machines outside the stores. I see people filling them up. You think the guy that owns that ever changes the filter in there? Why? Why would he? It's just cash cow. He's turning on tap water and giving it to you. It's junk. Anyway, so the next point for gut health is cleansing. Over the years, most people in the wellness movement hear about or get into bowel cleansing, and it's absolutely correct. There's a lot of ways to do it. I won't get into that. The simplest way is to either have a diet that's so good that you have 1 or 2 bowel movements a day, and then semi-annual or annual cleansing, which is another topic on another day. And then the final thing about gut health that's important, just to mention today, is identifying food allergies. People develop allergies to food with age. People have them when they're young. It's complex. I won't get into it. But you should always pay attention to when you have bloating, gas, intestinal discomfort, you just don't feel right. Pay attention to your food patterns and see if you can figure out what foods are doing it to you. Is there a relationship with food? Because if you develop food allergies, the whole gluten intolerance thing is epidemic. Wheat, grains of any kind, really, corn even. People develop sensitivities, and if you don't get off this stuff, you're toast. I personally think it has a big relationship with the amount of chemicals and pesticides and pollutants that are in the grain industry. But pay attention to that, because if you don't and you keep going through these symptoms and these issues, you're going to, the net result is an inflammatory reaction. If your bowel's inflamed, germs get in. As soon as you have inflammatory reactions, people with chronic bowel inflammation problems, colitis, irritable bowel syndrome, they are accelerating the infectious theory of aging. Okay, that's pretty much it. The skin was the other area I mentioned. And that's really common sense, with age, keep chemicals, cleaning products, especially organic, industrial solvents, keep them off your skin. I mean, you to give you one example, I was an auto mechanic for about 5 years before I was a doctor. I worked my way through school. And that's back when we used a really nasty solvent to clean auto parts. And I mean, I would get that stuff on me, and very quickly I realized, keep it off your skin. But I had a certain degree of exposure, and now I don't want that anywhere near that stuff. If I get it on my skin, it almost like it burns immediately. Anyway, it's a lot harder to get it, but you still can. But just household chemicals, all these products we use to clean, keep them off your skin. It means something, and the older you get, the more you'll see that. And then finally, the area of the lungs, very important with age. The younger you are and start, the better it is. Don't breathe the stuff. Don't breathe household chemicals, pesticides. If you're going to spray, weed eater and all this other stuff, wear masks. Even to the point, if it's really bad, you get a full face mask, a respirator. They're cheap now. And they're reusable, but because all of these things, airborne things that cause inflammation of your lungs, it's the same movie. Our lungs have tons of germs in there all the time from what we're breathing. Viruses especially, lots of viruses in our lungs. And you inflame your lungs for any reason, like smoking, that's lethal. I mean, people talk about, obviously, the damaging effects of the smoking, but the obvious implications here are staggering. Smokers are accelerating. One reason they accelerate, because they do, smokers age so rapidly. I mean, I see somebody smoke in 50 years, and they're 65 years old. I mean, they look 3/4 dead, soon to be all dead. I mean, even if they don't get cancer, it's just, and the infectious rate is much higher. Anyway, anything that irritates your lungs is going to cause an inflammatory reaction, and you're just opening the floodgates for viruses and germs to get into your bloodstream. And so, as I mentioned, there'll be more details about this, more little practical things to do and not do. But those are the big three things to minimize the speed at which infections are going to age you and march you towards disease. And that's pretty much it. I'm Dr. Debunk, debunking medical misgarbage and crap spread by doctors and other health professionals. Thanks for listening.